mankind history coming up, that we will all, our children, our grandchildren, great-grandchildren, will benefit, will be grateful to folks like Peggy. Because any time a new medical technology is being developed, that you always need a group of patients who is willing to go through that research program. And you're taking some risks whenever a new technology is being developed, because we don't know how well it would work and also how long the effect will last. Reading, getting older, reading glasses. You heard about several patients today. We have the Forever Young lenses. We have LASIK surgery to help some patients, but some other patients that we could not help. So how to reverse the aging, make you be able to read like some time ago, is still a challenging task for many patients. And we began the research program, embarked on research program a while ago, and currently we are one of the 3 centers selected by United States Food and Drug Administration as a testing center for this new breakthrough eye surgery. And right now we're part of the investigation sites, and it will take 2 years. Anybody in the United States who wants to have this experimental surgery called SSP for reading has to go to either Chicago, New York, or here. And we are very proud to be one of the 3 leading centers in the country. Actually, this particular surgery, I have done the most number of surgeries in the whole country, in the world, as a matter of fact. But there's only about 27 patients. Only 27 patients. So it's very new. Peggy, we will always be grateful for a patient like her because she took on the risk. She wants to improve her life, but also she wants to contribute to science and human knowledge. So her experience going through this experiment research process will be are documented, and all her measurements will remain as part of humankind's knowledge for forever to come. And she's in the clinical US FDA clinical trial, and the goal is to help her read and try to reverse her aging. So Peggy, maybe you can tell everyone, how did you initially hear about this research program here, and what has been the experience in terms of your reading? Did you feel that you could read better now after this research surgery than before?
Hello, my name is Peggy Gegax. I'm from Hendersonville, Tennessee. I came to hear about this surgery. It was back in December of '09. I was in my kitchen late at night, December, doing that Christmas cooking that you never have time for at like 11 o'clock at night, and had the TV on, and there was a commercial on TV advertising for Dr. Wang's new surgery that was a clinical trial study. And I listened to it and, wrote a few things down. It said, if you want to check it out, go online. So after I got my cookies in the oven, I went into the computer, looked it up, researched Dr. Wang, printed out some information. I have a friend, close friend, who had clinical trial study for LASIK surgery years ago. And I called her, talked to her a little bit, because I thought, well, sure, hers was a success years ago. She still is not having to wear glasses. And I thought maybe this is something that could help me, because I could not see to read up close without reading glasses. In fact, I enjoy crafts and stuff. When I do that, I do a lot of beading and stuff. I would find myself not wearing one pair of reading glasses, but I would be stacking them and still using a magnifying glass to do the little intricate beading that I do. And that kind of got to be a headache and stuff, so I got to where I wasn't doing it. And I thought, well, maybe by doing this process, it would help me. So through researching, talking to my friends and everything, I contacted Dr. Wang, came up. They came up for a couple visits. They did a lot of testing to make sure there were a lot of qualifications. I did qualify. I felt very honored to be chosen as one of the patients that was eligible for this trial study. Came in, and another thing that kind of egged me on to wanting to do this, in November of '09, my daughter announced that she was pregnant with my first grandchild. Well, I work at an elementary school, and there's children all the time. Well, here I was with my glasses down here, and I used to work with a lady that I constantly looked at that would wear glasses on her nose, and as a child, she was kind of frightening. And I thought, here I am in a school, and I'm looking at the children with these glasses on the end of my nose. I thought, I wonder, and plus two, parents would bring in babies. Well, when I hold the baby, I'd hold the baby, and the baby would be too close. I'd take the glasses off, and they were blurry, and I'm like, there was no seeing this baby. And I thought, I'm going to have a grandbaby. I want to be able to see my grandbaby and not be holding her out, at arm's length to be able to see her. So came up, they processed me. I got set up it was a year ago, March. I had my first eye done. They did one eye at a time. 2 weeks later, they did the second eye. I had to laugh some of it when I went back to work. They were like, well, what was the process? And I said, well, by looking at me, you can't tell, but I have implants. And they were like, what? I said, well, what I have in each eye are 4 implants. They're about the size of a grain of rice. What this does is helps the muscle in your eye that has relaxed in time to start working again, to make you able to see up close. And of course, with one eye, it was kind of tricky. I thought, okay, I've heard of people doing that, one eye for distance, one eye for up close. So with having one eye done at a time, I was like, this is real tricky here, trying to look afterwards. And the eye was healing and everything too, so it was an adjustment. But after the second eye was done, I could see right after the first one too. In fact, ladies, you'll know, as you put on makeup, you don't put your glasses on to put on your makeup. First thing I noticed after having the surgery was going in, and I thought, okay, I guess I'm vain. One eye had surgery, but my other eye was going to look good, okay? So I'm in trying to put some makeup on because I thought, because there is an implant. The eye was bloodshot because you are implanting something in the whites of your eye. There's a lot of blood vessels in there, so they break. There was a lot of redness to the eye, but there was no soreness. You had to apply drops by regimen. You had to apply, keep it cold with ice and stuff for the first day or so. But as I went into my makeup drawer and looked down, I opened it up and I thought, oh my gosh, that says Mary Kay. And then I looked and I was like, well, I could read the color. I was like, that says sable. And that said, and I could read, and I had never read those. I always, in fact, a couple of times I have put my lip liner on as eyeshadow because the pencils look the same. And if I was in a hurry, I can read it now. I was like, oh my gosh. Telephone would ring while of course, you're not supposed to do this, but as you're driving down the road, phone would ring, and I'm like, I don't know who it is, so I could look. I was like, oh, okay, I'll call them back in a minute. I could read what my phone said as I'm driving down the road or anywhere else, but without my reading glasses. So you have to also, after the surgery, work those muscles. So I'm an expert at word puzzles. There's exercises that you do and stuff, so it's a learning process going through this. You can see right away, but you have to build that muscle up after the surgery to get to the level that you want to achieve. So I think that's it.
Thank you very much. Appreciate it. So what we learned from Peggy's experience is that medicine is all about catching up the latest research, and we always keep our eyes on the latest, best technology. We're very proud of the fact that we are one of 3 centers chosen by United States FDA to be a testing center for this new technology, and it's just wonderful. From patient's standpoint, that you always need to know, you go to a doctor who is up on the technology, involved in research development, and so that you can truly get the best quality of care.